We are seeing mixed signs in the COVID-19 pandemic, depending on which number you look at. We might be getting better, or we might not. When you look at the cases detected, we might just be leveling off. Take a look at the dotted line here, the 14-day moving average. Notice how it looks flatter ever since July 20th, the day marked in red when the mask mandate took effect. That's a good sign, but we have to caution you, that is not the whole picture. The percent positivity rate has been above the guidelines for more than 3 weeks now. You'll notice it was low for most of May. It increased somewhat in June, but stayed below that critical 10% marker. But ever since roughly July 10th, too many tests are coming back positive. To try and spot more cases and spot them faster, the state ordered equipment and kits for rapid antigen testing. 100 machines have arrived, and once the kits and another 100 machines are all up and running, county health units could give people free tests with results in 30 minutes. A major improvement in spotting cases quickly enough for our 1,000 contact tracers to make a real difference. A few healthcare providers are already set up with those antigen testing, and THV11's Melissa Ziegowitz spoke with health experts about how effective these tests are and which test is right for you.
The demand for it has certainly been kind of overwhelming.
Ann Pace is the owner of Kavanaugh Pharmacy, which is one of the only places in Arkansas offering antigen tests.
If time is of the essence, then certainly this is a good option for patients.
From the time your nose is swabbed and then put through the machine, Pace can give people their results in under 30 minutes. The test is about 94% accurate.
But it is pretty unlikely to get a false positive, and it has a pretty low false negative rate.
Dr. Jennifer Dillahay with the Arkansas Department of Health says these tests are almost as accurate as a PCR test, which is the gold standard for viral testing.
The PCR test is looking for the genetic material of the virus that's unique to the virus. And the antigen test is looking for proteins of the virus.
While antigen tests can't be much faster, they also have to be run individually, making mass testing difficult.
PCR tests, you can do a mass testing and collect a lot of samples and run them the next day.
Antigen tests are the better option if you need to get back to work or see family, but it does come at a cost.
We're unable to bill patients insurance, so it is $95.
Pace can also only handle about 40 to 50 patients a day.
So there has been a supply issue. We just last week got another shipment in, but we have no guarantees of when we'll get our next shipment in, and we're certainly going through them far quicker than we can keep up with.
In Little Rock, Melissa Ziegowitz, THV 11 News.
Kavanaugh Pharmacy is offering test by appointment only, and you can head to thv11.com for more information.